Hello, EMP Honors Program and CV Academics Foundation members. Many of you know me, but some that do not. My name is Juliana. I'm one of the super mentors here on the site. And today I'm here with a special guest, Dr. Mohit Agarwal. Is that pronounced correctly?
Mm-hmm.
Okay. And I just wanted to first begin by welcoming you. We really do appreciate your willingness to kind of share your journey and just for us to ask a little bit about you. So without further ado, I'll just have you kind of introduce yourself and let us know your specialty and what you're doing at the moment.
Sure. Yeah. Thank you, Juliana, and thank you to CV Academics and AMP program for this opportunity to talk to you guys. My name is Mohit Agarwal. I am a radiologist by profession. More specifically, I'm a neuroradiologist working in academic practice. So part of my work is, of course, looking at images of the brain and spine, but also since I'm in academic practice, I teach future radiologists, future doctors who are going to be radiologists, residents and fellows who rotate through us as part of their residency and fellowship programs. So patient care and education are the two top things that I do.
That's awesome. I think it's amazing that you're doing, both pieces of that, teaching and then you're teaching students and then you're also teaching your patients. So you kind of get the best of both worlds there.
Right.
How did you become interested in radiology? It is pretty specific. So was there a certain, light bulb moment for you or not necessarily?
I think so. So radiology, I think, forms the backbone of the entire medicine. So what we do in radiology is we look at patient images. And so when you go to the doctor, you tell them their symptoms. So, I mean, they have sort of a list of things that they are thinking about, and then they order an imaging test. And then the patient comes to us, and we have the ability to look inside the patient's body, at all the images, and then we can deduce what's going on inside the body and find out what is causing the symptoms. So during my rotations through med school, I realized that this is something that tells you what's actually going wrong with the patient. So we sort of provide a very important piece of information to the treating physicians, and I thought that was really cool. And that was the moment for me when I decided that I wanted to do radiology.
That's an interesting way to look at it. I've never thought about it as, like the backbone, but that's true. I mean, if you need more information, that's one of the first, ways of testing or workup for certain patients. So that's awesome. Um, as far as day in the life, can you describe a day in the life of your occupation and what you do?
So again, as I said, there are two components of what I do. So of course, patient care and looking at images is a very important aspect of what I do. So typically, we look at millions of images throughout the day. We open up an exam, look at the reason why the patient was there, what the doctor thought about it, what different conditions they think the patient could be having. And then by looking at, so many images throughout our career, we have sort of an idea in our minds what the patient looks like or what the images look like, what a certain organ looks like. And looking at that information that the patient has told the doctor or the doctor has told us, we sort of scan individual organs and try to find out what's going on there and try to identify what the abnormality is. And then, of course, formulate a report, and in that report tell the treating physician what we think is going wrong and what could be causing the patient's symptoms. So I mean, throughout the day this is what we do, but because my job also involves educating residents and fellows, when I'm going through all these images, I am also teaching the students, the radiology students, side by side, telling them, okay, this is what I think is going wrong, and then train them for the future. So those are the two components that sort of define my day.
Interesting. And when did you begin, you started off as a radiologist. When did you begin having students follow you and to actually have that other educational piece to your career?
So I think Med school is sort of designed in that way. So even, even when you're a medical student, you're sort of mentoring your junior colleagues, so to speak. And then when you're doing residency, you're mentoring medical students. When you're doing a fellowship, you're mentoring residents. And then when you become faculty, you sort of mentor everybody. So I don't think there is really a point where you sort of become an educator from being a student. I think throughout the career, at least the medical school is designed in such a way that you have opportunities to be an educator at every level.
Mhm.
So, I mean, at the attending level or at the level that I am, I think you can make that educational sort of difference in a greater way. But in their own right, I think every person who is in med school is an educator in their own right.
Mhm. I feel like in healthcare, that's a huge piece of healthcare is not only teaching always, whether you're, first year med school or, where you're at in your career, but it's also the learning piece of it too. You're learning every day from everyone. And
Right.
that's the beauty of healthcare, I think, is just
Yeah.
learning each and every day and learning from mistakes.
Yeah.
And that's awesome.
Yeah.
Is kind of going off of that, do you have a favorite part of your job? Do you have a least favorite part? Or do you love it all?
I do tend to love it all. I think I have a passion for education. So, having being in an academic practice really feeds to that. I was always really interested in teaching. So I think being in academic practice gives me that stimulus to keep working because I can, train the radiologists of the future. I really like that component of my job. I really also like looking at images and doing what I do, what I'm an expert in. I'm an expert in neuroimaging, and that's what I love to do. I love to talk to my, physicians who have sent me patients for a consult, to talk to them and let them know, what's going on with the patient and be really involved in patient management. I think I love both components a lot. I do like teaching, maybe a little bit better. So, yeah.
But overall, the patient interaction is something you love, it sounds like, or the human interaction, I should say, between the other physicians and patients, students.
Yes, yes, absolutely, absolutely. I think healthcare is all about human
Mhm.
interaction. I mean, that's the essential piece of medicine to be able to make a difference in other people's lives. And being an educator, I can do it in two different ways. By looking at images, making a difference to patients' lives, and then making a difference to my students' lives by educating them. So yeah,
I love that. That's another reason why I got into nursing and the healthcare field is that human interaction is important for me. That social piece of it as well um,
right.
is very motivating. Um, is there any piece of advice that you could give to AMP Honors Program members? Is it there something that kind of as you mentor other students and kind of guide them? Is there something that you could provide for the AMP students as well?
I think hard work is very important. I think that's an essential piece of any work, whether you're in any discipline. I think hard work is very important. But I think over the years, what I've felt is that you should have a goal in mind.
Mhm.
So if you're working towards a specific goal, your hard work really pays off because you're working towards that goal. So having your eyes set on a certain thing really helps you work towards it. I mean, you can do a lot of work if your efforts are not concerted to a certain specific goal. Um, your results might vary. So my biggest advice would be to set a goal and then work towards it.
That's something that my dad used to always teach me too. He would always tell me, kind of know your why. And I think that's a piece of if you have a goal, that's kind of your why you're getting into the healthcare field or why you're going to med school versus nursing school or vice versa. So I think that's a really good advice. And I think a lot of students will take a lot away from that.
I'm a
You
dad
know,
myself. My daughter is going into high school. That's what I tell her too. Have a goal and work towards it. So I
mhm.
think it's probably a dad thing.
Maybe it is. Maybe it is. My last question for you, and this is kind of random, but I was asked this during an interview once, and I just think it's interesting. Um, would you rather know a lot about a little or a little about a lot?
I think I would know a lot about a little, and that sort of defines me because
Mhm.
I'm a doctor,
Hmm.
I'm a radiologist, which is little, and then I'm a neuroradiologist. So I'm very, very specific in what I do. And I really love what I do because I know a lot about this little field. I mean, it's not little, it's the brain and the spine. But then it's a very focused and a specialized field. And I love to know a lot about my own field. It makes you really an expert. So I really like knowing a lot about, a smaller thing. It's good to know a little about everything,
Hmm.
but then this particular thing that I specialize in, I like to know a lot about that.
I agree with you. That was my answer to that question as well. Um, so thank you for sharing that. And on the behalf of the entire CVA team and myself, we just wanted to thank you for being here and sharing just a little bit about your specialty and your profession. And it was even something new to me, so I loved learning about it, even in the short period of time. So thank you so much.
Thank you, Juliana.
This has been a presentation of the CV Academics Foundation, home of the AMP Honors Program.